Hey guys, Kati Kleber here to talk about the CSC certification. Your questions answered. So I have some of the top questions about this specific certification. I'm going to go over the answers here. The place I got the answers to these from two sources. Number one, the American Association of Critical Care Nurses, the people who actually have created this exam and provide this certification, as well as Nicole Kupchik's website, and actually her personally, who teaches a CSC review. I have links to both the handbook as well as the policy book, as well as her review below this video. Okay, so what is this exam and certification? So it's cardiac surgery certification, a subspecialty certification for nurses who already have a certification in critical care or the progressive care, and it's for people who have take care of patients within that first 48 hours after cardiovascular or cardiothoracic surgery. Okay, so the cardiac surgery certification. All right, so you can't just go take this one as your first certification. You have to have another certification for it to be attached to. All right, so if you don't have any certifications but you're interested in this and you work in critical care, you got to get that CCRN first. Okay, I have links and resources about that as well below this video. But if you do have a CCRN or you have a PCCN, I believe those are probably the only ones that really make a lot of sense for this to be attached to. And then you can consider this one, okay? So you have to be taking care of patients within the first 48 hours post-operatively after CV, cardiovascular surgery, or cardiothoracic surgery, all right? So those of you who are working in neuro ICU, working on a stroke floor, probably can't take this exam, you need to have some specific practice hours, which is my next question. What's the required number of practice hours, and when can you take it? So you can't take this within a month or two of starting on that unit. You can't. This is something that you achieve this milestone after you've put in some hours at the bedside. So let me tell you exactly how many. And I copied and pasted it from the AACN's website so that I don't tell you the wrong thing, so I'm going to read it verbatim. You have to be an RN or a nurse practitioner, and this is a great certification to have if you're a nurse practitioner, with 1,750 hours in the last 2 years, and 875 of those must be in the most recent year. Of the total, 875 must be for caring for patients within the first 48 hours post-operatively in CV or cardiovascular surgery, okay? That's option number one. Option number two is you have practice hours as a nurse or nurse practitioner with at least 5 years, for at least 5 years, with a minimum of 2,000 hours in direct care of acutely or critically ill adult patients, with 144 of those hours accrued in the most recent year. Of those 2,000 hours, 1,000 need to be in the care of acutely critically ill adult surgery patients within the first 48 hours post-operatively. So you have those two options there. Again, that is straight from the American Association of Critical Care Nurses. Next question, how long does this certification last? 3 years, all right? What type of jobs would you have, or would this be great for, is you working in cardiovascular intensive care, maybe a cardiac step-down unit, PACU, or some hospitals are large enough where they actually have a CV RU, so cardiovascular recovery unit, because the recovery after cardiothoracic and cardiovascular surgery is so specific and complex. Some hospitals actually have their own recovery unit for those patients, and then some nurses work full-time in those units. So that would be a great certification to have if you're working in that unit. And that's the kind of jobs. It's not something like you have this certification and then you get the job. You have to have the job and then put in that large amount of hours, and then you can sit for the certification exam, if that makes sense. It's not like your BLS where you pretty much have to have that to get the job or get it very quickly after you get your job. All right, so what's it tested upon? What kind of topics are there? And again, I got this directly from the exam handbook with the percentages, okay? So the largest percent of this exam, 31, oh actually, no wait. let me redo that. So there's a few sections. So first, procedures. 19% of the exam is on procedures. Things like the cabbage, maze, congenital heart defect repair, valve surgery, like that is going to be testing you on those kinds of questions. Next is 31% of the exam is on the complications related to that. Cardiogenic shock, blood pressure issues, MI, ARDS, air leaks, behavioral things like adjustment disorders. Patients who have these major surgeries, that is a huge life change. Like a lot of them have near-death experiences and like a lot of psychosocial things going on with these kinds of patients and these kinds of surgeries. So being tested upon that, pulmonary hypertension, pleural effusions, pericardial effusions, those kinds of things. Other things, therapeutic interventions, 36% of the exam is on that. And then monitoring and diagnostics, about 15%. So procedures, complications, therapeutic interventions, and then monitoring and diagnostics. So those are the 4 larger sections of the exam. How many times can you take the test? According to that handbook, if you don't pass it, you can take it up to 4 times within 12 months. And if you actually retest within 90 days of not passing, then you can get a discount, okay? But if you take this review, you're not gonna have to take it again, I'm telling you. You need to do a review. And I got a nice little review for you here that you can take. And I've actually reviewed the whole manual myself, and it is lovely. So that's how many times you can take it. And another big question that people ask is, well, how much do I make? Like, will this, like if I get this certification, what is that gonna do to my my income level? Will it go up? And the answer to that question is, I don't have an answer. Hospitals treat nursing certifications incredibly differently. Some hospitals will provide nurses more compensation for the specialty certifications in which they hold, which I'm a big fan of. Hospitals, I think you should do that. Not all do. Some will say you can use this to add to your clinical ladder, so you can go up the clinical ladder, and that's how you get paid more. But just getting this exam getting this certification doesn't necessarily equate to more money per hour. So keep that in mind. So what I encourage you to do is to look at your hospital to see, hey, will they cover a certification review? A lot of them will, and test materials, and some of them will even cover the test for you, which is awesome. It's probably part of the Nursing Professional Development Fund. If you're working in a magnet hospital, there's a pretty good chance that this stuff could be covered. You'd have to pay for it up front, save your receipt, and then get reimbursed later. And that's how that's worked for me with my certification, and because hospitals want you to have these. So I encourage you to look at that kind of stuff before you commit to a review and to sitting for an exam and all that kind of stuff. So I've got links under this video for the handbook, the exam handbook, the exam policies, and a really great review that I've personally gone through that looks outstanding. Now, I'm not someone who can take this exam because I do not work in these areas, but I have worked CV surgery as a med-surg nurse before, and this review from Nicole Kupchik is wonderful, and I highly recommend it. And I don't do that lightly. I have very few professional relationships where I stand behind what they have created, and this is one of them, and I only do that because I have gone through it myself. And full disclosure, I am an affiliate of Nicole, so anytime that anyone buys one of her courses from these reviews that I do, then I make a percentage of that sale, and it's not at a cost to you. It's just kind of like, hey, thanks Katie for connecting these people with something that's going to help them. So Nicole, I've seen her speak at NTI, which if you're going to NTI, that critical care conference, highly recommend you looking up and see when she's speaking, so you can meet her in person and check out her reviews and her YouTube channel as well. Lots of great stuff, and she is really informative, and the way that she explains very complex information is very, she breaks it down in a way that really makes sense. So highly encourage you to check out her review. So those are all of your questions, hopefully answered about the CSC. Thanks guys.